Hi, welcome. Today I'll share highlights of our paper, Towards Responsible Data Practices in Digital Health, a case study of an open source community's journey. For some context, I'd like you to imagine yourself at your most recent clinical visit, sitting with your healthcare provider, even remotely. As you seek and receive care, your interactions with your clinician and the healthcare system generate massive amounts of information. Primarily, these data are used by your clinical team in providing you care, and if you're unwell, to guide your clinician to a diagnosis and treatment. Yet, as you know, these data also offer massive potential beyond your direct care, including informing public health disease surveillance interventions, supporting a huge spectrum of research, and informing health policies. But as a patient, what you decide to share may not only have direct consequences on your own care, but it may also impact the health of your community or beyond. On the health policy front, in 2016, the European Union passed a strong personal data protection law that requires organizations to obtain your preferences for how they may share and use your personal data. Many places around the world have adopted similar legislation, including Panama, Kenya, Uganda, South Africa, Nigeria, and the state of California. From a human-computer interaction vantage point, we know that data flow is mediated by the technologies that we build and research, which leads us to our broad, multi-stage research question. How can digital health stakeholders best operationalize data privacy? We think about this research topic in two layers. The top layer is to understand what are the best practices and policies in organizational data sharing and use. The bottom layer looks at the interaction between healthcare providers and patients. Here we want to understand the best practices in patient consent, which is the critical link where patient privacy rights are established and documented between individuals and organizations. This case study covers two components, a literature scoping review and a participatory redesign of policies and practices to guide an open source digital health organization. Our literature scoping review explored two questions. What are the ethical and practical dimensions of collecting, sharing, and using routine data? And what are the best practices in informed consent? We searched 5 databases for empirical research and policy papers using scoping review literature methods. We fully reviewed over 100 papers. For more details on our methods, please see our paper. We highlight here a summary of our findings. For data sharing and use, the literature we found focuses on the ethics and practices of sharing data collected for research studies, rather than captured for routine care. There was a variety in data sharing models, particularly for research data. Several studies outline the need for and composition of data governance models. There were also many discussions around how to share aggregate or de-identified data, where the papers noted the many difficulties of truly creating de-identified data sets in the era of big data. In terms of informed consent, again, the papers we reviewed focused on how to conduct patient-informed consent for enrollment in research studies. Many studies highlighted the importance of staff training, given that consent is complicated, requires specific knowledge about data use, and often takes a long time to do. Additionally, the scoping review identified many gaps in the literature. Overall, it was difficult to synthesize our findings into robust categories. There is a lot written across the many disciplines on this big topic of data privacy, and from many vantage points. We think our difficulty synthesizing is emblematic of the complex landscape. Many of the empirical studies also took place in higher income countries. Our search of the main global health database did not uncover many articles. We suspect more country-specific inquiries and searches are warranted. We were also surprised by the gap in empirical studies of consent processes for routine care settings. This is potentially influenced by the newness of the EU-style legislation. It is also possible that additional literature or database searches may uncover useful research. Finally, there was a surprising lack of studies on digitally enabled consent. In our review, we found only one reference to digital consent, and it came from a US clinic that was simply entering information from a paper consent form into a database. More work here is needed. Now turning to the second part of our case study, where we explored participatory redesign of a digital health's organizational policies and practices. Here we explored the question of what are the critical elements to data sharing agreements, digital health policies, and internal practices that can support responsible data practices. Overall, this redesign process highlighted that policies and agreements and human resource requirements are highly interdependent. Frankly, it's a detailed and labor-intensive process to harmonize policies and processes. We also recognize that there is great need for this kind of work. We heard from many similar partners that stronger data policies and agreement templates would be useful, and Medic Mobile plans to share their templates after full legal review. Our research squad found it exciting to reconfigure partnership agreements to make them more user-friendly. We found, for example, that Medic Mobile required several kinds of data sharing and use agreements, so we worked to bucket out different partnership types to better suit specific project needs. We also worked to make the data use agreement a one-stop shop document for partners and Medic Mobile staff to understand the project-specific terms for data sharing and use. For our next steps, we'd like to co-design and reimagine informed consent. How can technology facilitate the consent process and support personal data rights? This case study showcases the complexity of extending data rights. It also highlights the literature that it currently focuses on data generated from research with vast opportunity to reimagine consent and data sharing for routine care. Informed consent would also benefit from more attention from the HCI community. There's an unspoken requirement for digital infrastructures that were not articulated in the literature that we found. These infrastructures are highly complex to design and will require rapid evolution to keep pace with data privacy standards. Thank you for listening. Please feel free to contact us with any questions or ideas.